Let me ask you something. What would you do if suddenly your chest felt tight? Not just a small discomfort, but a deep, heavy pressure, as if something was sitting on your chest. Your breathing feels different. Your body feels uneasy. And something inside you says, this is not normal. But then another thought appears. Maybe it's nothing. Maybe it will pass. And that moment, that hesitation, can be dangerous. Because when it comes to a heart attack, time is not just important. Time is everything. And here is something very important you need to understand from the beginning. A heart attack is not just a sudden event. It is the result of a process that develops over time and then reaches a critical point. And in this video, we are going to break everything down. What a heart attack really is, what is happening inside your body, why it happens, what warning signs you should never ignore, and most importantly, what you should do in that moment. So stay with me until the end, because this knowledge can save lives. Hello, I'm Dr. Yusoka. Now let's go step by step, because heart attacks are often misunderstood. Many people think they always happen suddenly and dramatically, but in reality, the body often gives signals. The problem is, they are not always recognized. A heart attack happens when blood flow to a part of the heart muscle is suddenly reduced or completely blocked. Your heart needs a constant supply of oxygen-rich blood to function. This blood is delivered through coronary arteries. When one of these arteries becomes blocked, part of the heart muscle does not receive enough oxygen. And when that happens, damage begins. The longer the blockage lasts, the greater the damage. Let's explain this simply. Over time, fatty deposits called plaques can build up inside your arteries. This process develops slowly, often over years. At some point, one of these plaques can rupture. When that happens, the body forms a clot at that location. This clot can partially or completely block blood flow, and that is when a heart attack begins. This is very important. A heart attack may feel sudden, but the underlying process is not. It is usually the result of long-term changes in the arteries, which means there are often risk factors involved, and understanding them can help prevent it. Some of the most common factors include high blood pressure, high cholesterol, smoking, diabetes, excess body weight, lack of physical activity, chronic stress, unhealthy diet. These factors affect the health of your blood vessels over time. Now, listen carefully. A heart attack is not just a moment. It is the result of years of silent changes. And that means prevention is possible. Now, let's talk about symptoms, because recognizing them early can save lives. The most common symptom is chest discomfort. It may feel like pressure, tightness, squeezing, burning. But here is something important. Not all heart attacks feel the same. Other symptoms can include pain spreading to the arm, neck, jaw, or back, shortness of breath, cold sweat, nausea, dizziness, unusual fatigue. In some people, especially women, symptoms can be less typical. That is why awareness is critical. Many people delay action. Why? Because they doubt themselves. They think, it's probably not serious. It will go away. I don't want to overreact. But with a heart attack, waiting can increase damage. Here is a phrase you should remember. Time is muscle. The longer the heart muscle is without oxygen, the more damage occurs. Acting quickly can reduce damage and improve survival. This is one of the most important parts. If you or someone else experiences symptoms, do not ignore them. Do not wait. Seek medical help immediately. Call emergency services. Sit down and stay calm. Avoid physical exertion. Every minute matters. When a patient arrives, the goal is to restore blood flow as quickly as possible. This may involve medications or procedures to open the blocked artery. And the faster blood flow is restored, the more heart muscle can be saved. Survival often depends on how quickly action is taken, not just on the severity of the event, which means awareness can make a life-saving difference. Now let's talk about prevention, because this is where real control exists. 1. Manage blood pressure. Keeping blood pressure under control reduces stress on your arteries. 2. Control cholesterol. Healthy cholesterol levels reduce plaque buildup. 3. Stay active. Regular movement improves cardiovascular function. 4. Eat a balanced diet. Reducing processed foods and improving nutrition supports heart health. 5. Quit smoking. Smoking damages blood vessels and increases risk significantly. 6. Manage stress. Chronic stress affects the cardiovascular system over time. Now, listen carefully. Joe, you do not need perfect habits, but consistent, healthier choices over time can significantly reduce risk. Your body often gives signals. Fatigue, shortness of breath, reduced physical capacity. These should not always be ignored. Listening to your body matters. A heart attack is serious, but it is not always unpredictable. Understanding risk, recognizing symptoms, and acting quickly can change outcomes. If this video helped you understand heart attacks better, support the channel by liking, subscribing, and sharing your thoughts in the comments. Have you ever experienced symptoms like these? Or do you know someone who has? Share your experience, because awareness can help save lives. And remember, when it comes to a heart attack, every second matters. This is Dr. Yusoka.